good luck, Emma. So our next speaker this afternoon is Dr. Emma Radbron. Oh, Emma, I feel bad that pull yourself together. I'll try and pull myself together, and we'll go from here. It's a real delight for me to introduce Emma to you. Dr. Emma Radbron. She's a nurse, she's a researcher, facilitator, and a teacher, and a beautiful person. She started her nursing career in Sydney 15 years ago at the Children's Hospital at Westmead, and she's currently living on the Gold Coast. She moved up there for love. Completed her PhD in 2022, which explored how nurses and midwives utilise data from an mHealth app to improve person-centred practice. Emma is passionate about person-centeredness and about participatory approaches to practice and research. She enjoys critical creativity, spending time with her family, and she's working on her next project, which is having her first baby in mid-April. So thank you, Emma. We'll hand over to you now.
No worries. Thanks, Beck. And yeah, thank you, Ashley, for everything that you shared and your vulnerability. I think that it's so important that we do hear from the people we're caring for, especially if we are committed to shining a light on person-centeredness. Sometimes what we shine a light on is actually really uncomfortable. It shows the cobwebs, the spiders, the cracks, the issues, and it's so important that we hear stories like yours so that we can take that and use it as motivation to continue to push for person-centeredness to be at the forefront and underpinning all that we do in healthcare. So thank you. And yes, tough gig to follow, but really, really grateful to have such a moving and powerful story after lunch. Certainly make sure that, we're all engaged. So thank you so much for the opportunity to present this afternoon. I'm really grateful to be here and be a part of a community of like-minded individuals. If we can flick to the next slide. Just a little bit of introduction to myself. Obviously, we're here because we're all about person-centeredness. So a little bit about me as a person. Like Beck said, I started my career at the Kids Hospital at Westmead 15 years ago in the emergency department. And I stayed there for over 12 years before moving up to the Gold Coast. Tried a few different roles in practice development, research, worked at Wollongong Hospital. So had a few different roles in New South Wales Health before coming up here, as my husband's a Queenslander. In terms of other things that I love and that are important to me, I love being out in nature. I'm a really curious person. That's my cat, Bonnie. And I think that her nature resonates with me somewhat in that, she's super curious and interested and loves being around people. And for me, that's always been a passion of mine too, is a genuine love, care and interest in the people around me and that I come into contact with. And then down the bottom left is my supervision team. So today's presentation is sharing the journey and results from my PhD study. And anyone who's done a PhD knows that a PhD is not a solo project, it is a team effort. And I was so privileged to be supervised by Professor Val Wilson, Professor Tanya McCants, and Dr. Beck Middleton on my journey through research and exploring how nurses and midwives use mobile health apps. Next slide, please. So in terms of what I'm covering today, I'll talk a little bit about the PhD study, the underpinning theory and some key learnings. But then what I want to focus on is an opportunity for you all to reflect on your own practice and how you can use data to evaluate and improve person-centered practice and shine that light on your own areas of work. And then, of course, opportunity for question and answer if we have time for that as well. Next slide, please. So before undertaking any PhD, you need to do a bit of background research, identify the gaps, work out what the existing literature is saying. And so for me, the interest was in mobile health apps and how they were used, particularly in nursing. So did a literature review and found that obviously it's going to be no surprise to anyone here that there's a lot of technology used in healthcare and there are heaps of apps available. You just take 2 seconds on the App Store, whether it's Google or Apple, whatever, and you'll see that there are an abundance of mobile health apps available. Now, while there are lots of apps available, there's not a lot of data on how those apps are used. And also there's not a lot of apps out there that are designed to capture data on the patient's experience. So Ashley's story, for example, there's not a lot of apps out there designed specifically for nursing, unless it's information-based. There's lots of resource apps, but there's not many designed to capture data around nursing care, and certainly not person-centered nursing care. There's also a scarcity of evidence available about how these apps are actually used and how the data from the apps is used, because the apps themselves are just tools. It's what is done with the data that really matters. And there was really a scarcity of information available to guide nurses and midwives when selecting the appropriate app, but then also in guiding them on how to use the data that they are collecting. And I reran this search as well at the beginning of last year and found that this was still the case. Next slide, please. So in terms of the focus of the research, the literature search that we did really helped shape the direction of the study. So the aim of the overall study was to explore how nurses and midwives generate data to evidence person-centered care using a mobile health app. And we developed 3 research questions. So we're interested in understanding, how do nurses and midwives generate data to evidence person-centered care using an app? How do they engage with that data to inform person-centered practice change? And then how does working with this kind of evidence influence them as people in their practice? Next slide, please. The study itself was underpinned by the person-centered nursing framework, also developed by Professor Brendan McCormack and Professor Tanya McCants. This particular framework is nursing focused, and because the intention of the study was to look at how nurses and midwives use the app and engage with the data, it was important for us to pick a theoretical framework that was specific to nursing. The study itself was also underpinned by practice development principles, particularly looking at collaborative, inclusive, and participatory approaches, the use of an importance of facilitation that informs critically informed action, and that promotes people to engage with research and data, not just have a study done on them, but actually be actively involved in the process. And also looking at transforming workplace cultures, ensuring that all people can flourish, not just as an outcome of, the results, but as part of the process and engaging in that process of exploring practice. And then, of course, active work-based learning. So we wanted to see transformation take place, of course, in a workplace if that was possible, but specifically also for the individuals involved in this study and the people that are influenced by the care. So we're thinking about the people that we're caring for, as well as the staff involved in this process. Next slide, please. So the app that we used is called the Impact app. Now, IMPACT stands for Implementing and Measuring Person-Centeredness Using an App for Knowledge Transfer. Now, this is an app that was developed by the team at Ulster University in Northern Ireland under the leadership of Professor Tanya McCants. And this app uses 8 person-centered nursing key performance indicators and evaluates practice, capturing the data in the app. In the past, they'd captured data using the 8 person-centered KPIs using a paper-based format, but with one of the opportunities that mobile health apps provide us is the ability to collect lots of data and keep it in a central location that makes it accessible and easy for everyone to use. So they tested it using the KPIs with an app and collecting that data, and that's where the app development has come along. So the app itself captured data. Yep, that's it, thank you. So there are a few different data sets collected. So we use patient record reviews, looking at the patient notes for evidence of whether or not the person's values and beliefs, what was important to them, was actually reflected in the nursing notes. There were patient surveys that were collected using the app, and each survey question related to each one of the 8 person-centered KPIs. The teams collected data of observations of practice. So there were 3 observations of practice going for 30 minutes each, where someone would have the app and document when a nurse was visible to their patient over a 30-minute period. And then there was patient recorded stories. So patients had the opportunity to share their story. So the people we were caring for in those units had the chance to be able to explain what it was like to be cared for there. What was their experience of care from the nursing team and the medical team. And then that information was transcribed and then read through the lens of those person-centered key performance indicators. So looking for evidence of them in the patient's own words as well. So those were the different data points collected that measured their KPIs, and they were all captured centrally in the app that was being tested. And this was undertaken in 6 clinical units across 3 hospitals in the Illawarra Shoalhaven Local Health District, with different specialties for each. So there was surgical unit, maternity unit, oncology unit, short stay unit, a day surgery unit, and a head, neck and throat surgical unit. So there was good diversity, and I was from pediatrics originally, so very different space for me to be working in. But as an external facilitator, I really enjoyed that process. Next slide, please. So the study itself used action research, and action research is about working with people, not on people, to generate new knowledge. And you can see there that it operates in a cyclical way. So we did a survey at the start and the end using the person-centered practice inventory, and that was to measure the impact of working with this data on the individual nurses themselves and their understanding or perception of person-centeredness. We then undertook 3 cycles using the app. So we would collect data with the app, reflect on that data as a team in facilitated sessions, look at that data and look for elements to celebrate when it came to person-centered practice, but then also reflect on the areas that needed to change. And each unit was encouraged to pick one thing to celebrate and one thing to improve. And I think it's really important that when we are using data to shine a light on person-centered practice, that we're not always looking for the negatives. Sometimes it's important, like sometimes you will see things that are worth celebrating. And I would argue that there's often things that can be found to celebrate. So it's important that we don't always look at what we did wrong. But we can use person-centered data as a tool for celebration and encouragement. Like Helen was talking about this morning, the importance of filling up the tank or filling up the cup of those that are pouring out in healthcare as well. Teams then, after evaluating the data, looking for things to improve and things to change, implemented those changes. So whether that was something to celebrate or improve, they implemented it. And then we waited a few months and did another cycle. And we repeated that process 3 times, collecting data using the app, evaluating that data, especially using other data sets. And I think that links really well with what Professor Brendan McCormack was saying this morning about making sure that we're using multiple methods of data collection and multiple methods of data to inform what we do. So we used multiple data sets and encouraged staff to think about what does this say about the big picture, recognizing that the person-centered KPIs were just one piece of the puzzle. So we used available data and then continued in that process. And then after doing that 3 times, we repeated the PCP-I survey. And then I also conducted interviews with 19 different staff from the research teams that were developed across the 6 units. Next slide, please. So in terms of the key findings of the study, it was so important to nursing staff that we got everyone on board. And having a team approach to using mobile health apps and the data that was collected was essential. It was important for the teams. They really mentioned the value of having external facilitative support. That helped them understand the purpose of the research. It helped them understand even what person-centeredness was. For some of them, that was a brand new concept. For others, it was about helping them develop their research skills or their research capacity, as Karen Takiri was talking about earlier, and providing that support for staff. Engaging in research with someone external to the unit actually really helped them develop skills that they could use in future studies. And then also to keep on track with the study as well, it was helpful having someone external to guide and support the process. Another key finding was that engagement with data was really influenced by the fact that the data we were collecting was meaningful to staff. The data coming out of the person-centered nursing key performance indicators was directly about nursing practice, and having the patient stories in particular was incredibly valuable for people. This led to insights such as the next point down, where staff were able to remind themselves or have a bit of a light bulb moment that, hey, there's a person in the bed. They're not just bed 8, or they're not just the cancer patient. They are a person first and foremost. And using that data really brought personhood back to the forefront for these nursing teams as they evaluated their practice with this data. There were also numerous changes implemented in response to the data, but those changes, like I said before, were about celebrating and improving person-centered practice. And in a couple of slides, I'll give you some examples of those. What we found too, by having this cyclic approach of using the app to collect the data and then evaluating the data as a team, it resulted in consistent improvements over time. And having a cyclical approach to evaluate person-centered practice was the key driving force there. It wasn't just a one-off intervention study and then we stepped back out. It was cyclical and we kept re-evaluating. And so that really made a big difference and sustained difference and improvement in person-centered practice over time. And then lastly, there were increased perceptions of person-centeredness. So that the survey we did at the start and the end showed statistically significant results in that working with data that is person-centered in its nature results in increases in perceptions of person-centeredness for the nursing teams involved in this process. Next slide, please. So here are some examples, and I know they'll probably be very small on the screen, but we just mapped them to the person-centered nursing framework there to show where these changes fit in the big picture of person-centered nursing practice. So you can see that there are some really practical examples like purchasing extra equipment and fixing elements on the units. But for one unit, they even went to the effort of changing staffing. So using this data for them was a real tool, or collecting this data was a real tool for them to advocate for the fact that they needed more staff on night shift. The patients that had been surveyed and the patients that had provided their stories were expressing their concern for night shift workload and the ability for staff to be present and meet their needs on a night shift. So they were able to use this data to make big system level change. And after this, when we spoke to the teams, they said, we will never go back to having, less staff on night shift. We feel so much safer, and the people we're caring for feel safer too. Our IMS, our incident management results have gone down. So they were able to make changes to their models of care and their staffing numbers. They're able to adopt team approaches to nursing rather than lots of different siloed approaches that had been happening but had been unaddressed within these departments. So the data gave them the opportunity to not only explore practice, but make actual change and sustain change over time. Next slide, please. In terms of the overall strategies that we would recommend based on what we've learned from working with these 6 units is that teams really value meaningful evidence. And if we want to make sure that the data that's collected by apps is actually used in practice, it needs to be meaningful for staff. We also need to make sure that staff are supported appropriately with the right technology and the right resources, whether that's physical from a technological perspective or from people resources. Teams need to be supported if we want them to use the data that comes from apps. Otherwise, it becomes just another tick box exercise and teams are just collecting data for data's sake. But it's so important. Like, that's not where change and the power to change lies. It's not in collecting it or being able to collect it. It's actually using that data to inform practice and change. Another thing that's really important when it comes to using mobile health apps to evaluate person-centered practice in nursing is that we involve the whole team and that it becomes a team approach. It's not just a research nurse's job or the manager's job, because if it's run by an individual, then you're not going to get that cultural change. And the importance of person-centered cultures was spoken about this morning by Professor Brendan McCormack. And it is so important that it becomes a team approach, a collaborative approach, if we want to see changes embedded in practice and if we want to see engagement of the broader team. Another thing that's also really important is that the team have engaged collective leadership. And I think Karen Takiri is a perfect example of someone who is engaged and committed to collective endeavours to explore and embed person-centeredness into healthcare strategy, policy and bedside practice. And it's so important for teams when they are using mobile health apps that they have an engaged leader and they have collective leadership where it is shared. There is no power imbalance. That is a real team approach. And then lastly, external facilitation, which I've mentioned a little bit earlier, but the teams really valued the support, like having someone external to the unit to not only drive the study and keep them on track, but to facilitate that process of reflection on data. And it's reflecting on data that then enables it to be understood and then used to inform practice change. So those 4 sort of key strategies were what our main learnings were, and they've just been published in a paper that's come out just last week, actually, which is good timing. So feel free to check that out for more information. But it's these kind of strategies that not only help apps be used successfully, but the data and the research collected from them. And we know that if teams are supported to collect data and engage in research, supported then to unpack that, it's going to lead to person-centered change. And that's the overall outcome, I think, that we're all wanting to see achieved. Next slide, please. So a few questions for you all to reflect on. I know we're post-lunch now, so I thought rather than talk to you for 30 minutes, I would pose some questions for you to personally reflect on. So the first one is, well, how are you collecting data to shine a light on person-centered practice? What is available to you? And perhaps you're not even sure in your workplace at the moment. Maybe you have an interest in person-centeredness, but you're not sure how data is collected. Well, I encourage you to write yourself a little to-do list after today's symposium and reflect on that and go, okay, well, yeah, how would I know if I am being person-centered in my workplace, or how is that measured around here? The next question I want to pose for you to reflect on is, are there any complementary data sets that you can use to shine a broader light on person-centered practice? I was stoked when I heard Professor Brendan McCormack this morning mention the importance of not just having one single data collection point, but having multiple data sources to inform person-centered practice and what we do. So what other complementary data sets can you use collaboratively? Instead of lots of research taking place in silos, what can you bring together to help inform the big picture? And I would say that patient stories form a really important part of that, as we've heard from Ashley this afternoon. Thirdly, what processes are you utilizing to reflect on and use the data? Getting handed a research report means very little to a lot of people. And to be honest, the nurses that I worked with in my PhD were just looking for faults. All they were looking for was, where did we go wrong? What can we do better? So it was a really novel experience for them to have a facilitator come in and help them unpack and reflect on the good things that they're doing and celebrate the care that they're delivering. So what processes are being used in your workplace to actually reflect on the data that's being collected? There's so much data that's available and being collected thanks to technology, but how are we using it? And if you're not using the data that you've been collecting in practice, I want to put a challenge out there to you to think about, well, how can we use it? We have ethical responsibility as researchers and healthcare practitioners engaged in research and academics engaged in research to actually use the data we collect. We hear people's stories and we have a responsibility to act on that. So what processes are you using in practice to reflect on that data? And then lastly, and hopefully this could be a bit of a discussion point, either in the chat or people unmuting, but what do we do when the data shines light on things that perhaps we don't want to see? Because that can be quite challenging and quite confronting. I know that definitely happened in the study that I was part of, and I was able to support the teams using some practice development principles to explore their unit and their leadership and their approaches and the truth in the data and what it was really saying. But sometimes the data that we collect shows things that we don't really want to see, and that can be quite confronting. So what do we do when we shine a light on things that perhaps we don't want to see? It's a question I'm posing to everyone to, think about, maybe pop in the chat or unmute if you're comfortable to share a story of when that's happened and how perhaps you've processed that.
Certainly a challenging question to finish with there, Emma. Thank you. Thank you for posing that. And I'm wondering if there are any people that would be happy to share an experience where, data has shone a light on something that perhaps has challenged them personally or with their values and how they went about. Yeah, thank you, Eb.
That's okay.
Thank you so much, Emma, for that really awesome presentation. I think it speaks to me, especially as a biostatistician, because I come from quantitative background when it comes to methodology. And I often see people very polarized when it comes to using qualitative data or quantitative data, and being very focused on being data driven rather than being theory driven, which I think could be a major problem. Especially in a field like nursing, where so much can be learned from practice, from doing, rather than focusing solely on this is how I'm going to do it. It's not so much a question, but I was really intrigued with maybe if you want to share a little bit more about when you found that there was a conflict between what you expected, but what data showed you were two different things. And I think, again, going back to the statistical viewpoint, statisticians often love to make hypotheses before running an experiment, whether it be observational or an experimental study. And once data comes in, we often find that actually it doesn't match that well. Not always, sometimes it does perfectly, but not always it's a perfect match. And quite a lot of times I find that researchers find it very difficult to come to terms with that, and often struggle with that idea. So in your own journey, how did you sort of overcome that within yourself?
Yeah, great question. And I think you raised some really good points about the polarization between data collection methods. And it is so important to have a combination of data sets that are both qualitative and quantitative. And I think that's what was one of the keys in working with the teams, was making sure that as a researcher that I had a person-centered approach, and that I just sat with the teams and sat with them in that uncomfortable space while they reflected on their practice. And I facilitated the opportunity for them to reflect. And like Helen was saying this morning, it's so important that we can pause the busyness to take a moment to really reflect on the kind of care we're delivering and what this really says. And how in research, we need to push aside our hopes for the study and come back to the reality of the data that's in front of us. If we're truly being person-centered and acting out of our values and who we are as people, it's so important then that we carry that into the research we're doing. Obviously, we have an ethical responsibility, but I would say as person-centered researchers, it's about that embodiment of person-centeredness and the being that Brendan was talking about this morning. So for me, that really helped me in working with teams. I felt confronted. I felt bad for them that they got results that they were devastated about. I felt really sad for them at how personal they took some of the data and the way previous experiences of research had been handled. And so I did my best to be as person-centered as I could and to be as honest and open as I could, and held space for the teams to work through that. And also made sure that the voices of the staff who were in the micro level, who didn't feel heard as much, actually were able to have a voice, and I could advocate for that as part of the research process. So I think person-centeredness has a really important role to play for us as researchers working with teams, unpacking uncomfortable data as well.
Yeah, great response. Thank you, Emma, for sharing that. Are there any other questions from anyone?
If anyone would like more information about the app, you can definitely reach out. My details are on one of the slides there that can be shared. And also, obviously, Professor Val Wilson is continuing that work. There's been new stages of development for the app and other sites that it's being rolled out in. So if you are interested in using the person-centered key performance indicators in that way, then yeah, please reach out. They're a really, really valuable tool for evaluating person-centered nursing practice. Thank you.
Yeah, thanks, Emma. Thanks so much for sharing your research, such valuable research with really terrific outcomes, and good promotion of your latest paper as well that's just come out last week. Well done.
No, I just feel like that's probably the most helpful.
Yeah, it is. It's a beautiful summary of your work. So yeah, good plug. And